I had seen a lot of my friends, well, a lot of my colleagues, no close friends, but a lot of my colleagues and a couple of my friends' relatives get cancer
Okay.
and pass from it. Um, I had my grandmother died from cancer,
Okay.
but at the time I was really younger, much younger. I mean, I was a grown person. I think I was in 20, around 20, 22, something like that, at the time when she passed. And didn't know she had cancer until I think on the last, because this was in Mississippi. I was born in Mississippi, and I'm not ashamed to tell anybody I was born in Mississippi. It's a terrible state. Sorry, but it's still terrible. But I didn't grow up with a terrible life. I grew up with a family with love. My sister and I had this discussion last night. She was saying, but we were very poor. I said, no, we weren't. I said, we were poor. We didn't have a lot of money. I said, we didn't have a lot of money, but we were not poor. That's not, to me, the indication of poorness. I said, because we had a family who loved us.
Absolutely.
We had our own house.
Yes.
We had property. We grew food. So we made off. I had a lot of money to spend, but we had love around us. So to me, that was important, and especially for me, who at age of 5, I think, became ill. At the time when I first got sick, they thought I had polio, but I didn't. It was the time when polio was going on.
Okay.
But instead, I had something called rheumatic fever. They call it rheumatic fever, it's rheumatic heart disease, actually.
Okay.
And I had that. I think it's been about paralyzed about 6 weeks, I think they said. And I got better, went back to school, and then one day going from school, on the way home from school, my shoulder and things started jerking and going on. So we went back to the doctor, it was back again. So I lived past that, got past that. By the time I was 16, I was doing much better. The doctors were giving me a good thing, and I was feeling pretty good about myself. I remember when I got here to Chicago, I had never ridden a bicycle because I couldn't do a lot of physical things when I was younger.
Okay.
I remember I bought myself a bicycle, put some training wheels over. My kids fell out laughing because I put training wheels over. But
Beautiful.
I learned how to ride this bicycle as a grown person, So my life was going pretty good. I would have some problems every now and then with indigestion and stuff like that. Nothing serious. I went to the doctor most of the time. And then I discovered that I had fibroids, but that was to me the one thing that wasn't life threatening. Okay, so had the fibroids removed, as a lot of women will do. And then what happened? One year I was having some sinus problems, and went to the sinus doctor, and she operated on me. And I asked her at the time, I said, was it cancer? She said, oh, no, I don't think so. And she never told me it was cancer, but it was.
Wow.
So in 2004, I started having a bleeding when I would go to the bathroom. So I told my primary care doctor, and he said, that's nothing to be worried about. A lot of ladies get the bleeding when they have urinary tract infection or something.
Okay.
I said, that's not me though. I said, I need to see a specialist. So I went to see a doctor named what was her name? I can't think of her name. Dr. Beck, Dr. Tracy Beck. I went to see her, and it was like in December, about a week or so before Christmas. And she was examining me. She said, oh, okay, there it is. Oh, what is it? She says, it's cancer. She said, we could operate on it just for Christmas. Do you want, we could wait right after Christmas and do it.
Okay.
And I said, can I wait till February?
Okay.
Because I was getting ready, my church was going to San Juan, and I sang in the choir. We were going to be singing in the choir. I said, and I already paid to go to San Juan, so I said, can we wait till February? She said, no, you can't wait till February. You can't play around with cancer. So I guess it found it sank in a little bit. So I said, well, can I do it by mid-January? So she gave the 17th of January to come back for the counts to get the surgery. So I came back, went to San Juan, came back, and I remember I was in San Juan at the church. A girlfriend of mine who had breast cancer, they knew I had the cancer, was diagnosed with cancer. So she said, go up there and get prayed for, go up there. So she drugged me up front, and the minister prayed, for those who were sick and, prayed for me. So I came over back and had my surgery on the 17th of January.
Now let's go back, Dr. Townsend, and talk about the diagnosis itself.
When
When you were first diagnosed,
Yeah.
what did she say to you, and what kind of
I was on the
cancer?
table, and she said, okay, there it is, it's cancer.
Okay.
And that's what she said. So she asked me, she said, well, you can bring your family or we'll discuss something. So I have a son and a daughter, so we all went over. So she had told my daughter, she said, your mother took it so calmly. She said, and my daughter said, my mother's a psychologist. She said, yeah, but I've seen other people who be psychologists, they don't take it that calm. But for me, I felt that at the time when it happened, see, this was in 2004, that I had a pretty good life. Other people had cancer. Either God took care of them, I had to turn it over to God. And,
Yes.
I'm going to follow what the doctor tells me because I think God is telling the doctor what to do.
Yes.
But I'm going to follow and I'm going to read. I get on the thing and read up on stuff. So that was how she diagnosed it. She saw it. She put me on the table and she, had me stretched open and looked up there and she knew what it looked like. But in
Okay.
the meantime, she did have to take a piece of it and send it to the lab. So
What kind of cancer did you have?
it was bladder cancer.
Bladder cancer.
Cancer in my bladder. Mhm.
Okay.
So so I said, okay, so we did the surgery. We both, she and another doctor did the surgery at Mercy Hospital. And I couldn't do the treatments until about a month afterward. So the month after the surgery, they started the treatment. The treatment medication is something like tuberculosis,
Yes.
but what it does is it kills this, possibility of germs coming back in there. So after a month after surgery, we started the treatment. The treatment was not called chemotherapy. The treatment, I had to go and they would put this stuff in my bladder and I had to hold it for 2 hours.
Okay.
Ooh, which was pretty painful. You had to hold every drop for 2 hours. And I was supposed to have 12, I had 8. And it got pretty painful, so she stopped. And I thought that she would give me a rest and go back and do the other 4. But she didn't see anything else for a while. So after we stopped, I would go for treatments for every 3 months. For examinations every 3 months. First it was every 3 months, then it was every 4 months. Then it was twice a year. Then it was once a year. And so I had gotten down to once a year with that, not seeing anything.
Dr. Townsend, let me stop you right there and ask you, during the first time, all of the treatment, what was going on in your mind?
Well, somehow or another, I always felt I was going to make it through it. That I think because I had been through a lot of stuff as a child in terms of being sick,
Yes.
and figured out that I had to trust God, that this was something, and if I didn't get through it, then it was my time to go. But in the meantime, I was trying to do whatever I was supposed to do to get through it. I didn't take a position that, oh, poor me. I never had taken that kind of position. Oh, poor me, I just kept going and doing stuff that in fact, people at my church said, boy, you're amazing. you have things, you get sick one day, next thing you're back here again doing stuff, In fact, even when I had the bladder cancer, I really didn't stop doing other things that I was part of the Association of Black Psychologists. And I was at that particular point the Midwest Regional Chair. The Midwest Regional Chair has to go around to all the Midwestern states and talk to the psychologists who have board meetings in those areas,
Yes.
put on conventions or whatever. So I kept doing that even with the bladder cancer. So out of my mind, since we hadn't seen anything since 2005 with the surgery, I'm not even thinking about the bladder cancer at all. And every year I would go to get my mammograms.
Okay.
I've been doing that since I was in my 20s because I had fibrocystic cystic breast disease. And in fact, when I had the bladder cancer, I was kind of shocked because I was expecting to get breast cancer
Okay.
as opposed to the bladder cancer.
Okay.
So every year I would go and get my examination, mammogram, and sometimes they would do ultrasound, and send me back and say, no, we don't see anything. So in 2011 I was in there, they saw nothing. 2012 when I went back to St. Joseph Hospital, I know they did the mammogram, and then they decided they want to do an ultrasound. And it took a long time. They went and got because you have the tech.
Right.
He went and got the doctor. And the doctor and the tech was working. I'm saying to myself, something's not right, because of the fact that you go to get the doctor and you all are working on me this long to try to find out what's happening. So when finally the doctor said, you need to see your doctor, he needs to order some more tests. So I left, and I didn't hear a word from my doctor. And I was surprised because I knew he said he was going to call him. So finally I called my doctor. I said, no, he called me at home, the doctor who was doing the examination at St. Joseph. Did you all not do anything yet? So I said, I haven't heard from my doctor. So I called him. Well, call him in. I said, no, he didn't send me. I said, go look at the record. So he went and looked, and sure enough, there was a thing there saying she needs to get some further examination. So to me, that meant, something's more serious. And St. Joseph is 2900 north. And at my age, I got a lot of friends who are afraid to drive a long way. They'll drive around the neighborhood,
Right.
but they don't drive a long way. So I said, that's too far for me. They had to have some of my friends try to go up there and see about me if I really need to have surgery. So I called Chicago and asked them, could they examine me? So they told me to bring a copy of my exam. And I went back to St. Joseph, and they gave me a copy of what they had. They looked at it, so they said, we have to do some more. So they put me on the table, and they did some more x-rays, and then they took a piece, and they sent it out. And then they called me, and they said it was cancer.
Again, this is the second time.
No, this is the first time it's breast.
Oh,
This
so
is breast cancer.
it was no longer bladder cancer
This
now.
is breast
It was
cancer.
breast cancer.
So this is breast cancer now. So I'm going like, oh, okay, got breast cancer. So they, what they do when you have cancer is they after get the results back, they also try to find out what kind of cancer. Not just breast cancer, but if there's something else in there. And so what they discovered would be, I forget what they told me the word was, but I was not even stage 1. I mean, it was just there. It was real small. And some lady who was doing research wanted to put me into research study before they did any surgery or anything using this medicine. But it was going to be a blind study.
Okay.
And so I know what a blind study is. You may not even be in the part getting the medicine. They follow you, and they got two groups. One who's getting the medicine and one who's getting nothing.
Wow.
And so you don't know if you're in the group. You're getting a placebo. And so I may be getting a placebo as opposed to getting the real stuff. So the lady said, I said, she haven't even called me yet to get started. Well, you won't know which group you're in. I said, I understand blind studies. I said, but she haven't even get started. No, I think I don't want to do that. If I got cancer, I need to go ahead on and get started on it. So what they did, they come together, all the doctors over there come together. The surgeon, the oncologist, there were about 4 doctors.
Okay.
That they came together, and they decided that my cancer had some kind of receptors in it. I know. It had, I'm not mixed up, I know, I just can't say the word right now. Give me a minute. Estrogen receptors.
Okay.
And so, if you have estrogen receptors, it's better for you, in a sense, because then they can block any estrogen. And I should have realized that because I kept getting fibrocystic breast disease stuff.
Okay.
For the time I was in my 20s. So they decided, okay, we will take the cancer out, and then we will just give you radiation, and you take a small pill, but it's not chemo.
Okay.
It was this pill that blocked any estrogen I had. And so on the first Friday of January 2013, they went in and operated on me. Plus, they had me come and bring kids, and they talked about what was happening. So the first Friday, 2/13, they did the surgery. You do the surgery, come home.
Okay.
And so you wait after that, but before you go to do the surgery, you see everybody else that you got to see. I had to see the lady who's going to do the radiation doctor. I had to see the oncologist, all this before. And I know when I was down in the radiation, because in the meantime, I know I had cancer of my sinus until I was down in the radiation department, and he was going over my history. And he said, let's see here. He said, you had sinus, you had cancer in your sinus. I said, huh? I said, what are you talking about? He said, he named the date. I said, nobody ever told me I had cancer. He says, cancer of the sinus.
Wow.
So I was so upset about the cancer of the sinus, not being told, not that I had it, but you didn't tell me so that I could be, checking out and make sure I'm getting follow-up treatment. I couldn't understand why that lady did not give me a follow-up treatment all the time. And why, when I asked her, was it cancer, she said, I don't think so. But maybe after the lab came back, she just probably didn't even bother to call me or look at it real good. So here I'm going like, okay, now I got 3 cancers. So we did all of the things they're going to do for me. They had, not only that I had the surgeon, I had her nurse practitioner. If I had to talk about anything, if I was any worried, in fact, talk to the nurse practitioner before the surgery. And she was telling me what kind of bra I had to wear. I couldn't wear any lace stuff. She told me all the stuff, and whatever I had to do, what kind of soap and stuff I need to use.
Okay.
So I wouldn't burn up my skin, mess up my skin. And so I saw all these doctors and the nurse practitioner beforehand. After the surgery, I had to wait for a little while. Then I went down. I think it was about 6 weeks. Went down, and they had to set up the table, use a table to set up. They had to build it so that the only thing that's hanging down is this breast.
Okay.
Every other part is protected.
Okay.
And it took a while for them to build this mesh thing because it go all around here. And so you just got your breast hanging down through there, and nothing else is getting affected by the radiation. So that took about a week or so of going for that.
Okay.
Then they made me go to see a therapist because I was having a little problem with this arm, and they wanted to make sure that I could hold the arm back far enough while they doing the radiation. So I did the radiation. I had short radiation because when they did the surgery, I was on stage 1, if you could call it a stage.
Okay.
None of my lymph nodes. It was not in any lymph node.
Okay.
Right. Which meant if it's in a lymph node, if it's in one lymph node, they call it stage 1. The more lymph nodes in, that's what they named the stages.
Okay.
So they said that no. So I started, that must have been in March. I went about 6 weeks for radiation, and that was it. So after that, I would go back. So then the doctor Dr. Hoffman put me on this little pill to take to block my estrogen.
Okay.
So I'm going like, I went through menopause a long time ago. Why? They said, but your body still had estrogen in it.
Okay.
So they was blocking the possibility of it. And we had to discuss with the nutritionist what kind of food I could eat and couldn't eat.
Okay.
For instance, I already knew some time before that I could have nothing that had soy in it. My other doctor had told me, because I had fibrous cystic breast disease, do not use soy. No soy products at all.
Okay.
People think, oh, get the soy milk. I don't drink soy milk. I drink almond milk that's without soy in it.
Okay.
So I had to talk to the nutritionist, so she had to tell me what all to do and what all not to do in terms of eating.
Okay.
Because soy has got estrogen in it, will bring back the possibility of fighting off. Also discussed the fact that I could only take certain vitamins. I had to take vitamins B, vitamin D, D3. They tell you what you want to take. And a vitamin B, I think vitamin B. No vitamin C.
Okay.
which was amazing because I told my girlfriend, what, everybody supposed to, I said, hey, they say if you get it in your food, fine, but do not take any vitamin C pills.
Okay.
So today I don't buy vitamin C pills. If I'm gonna get some vitamin C, I'm gonna get it naturally, like out of orange juice or stuff, something like that, out of the vegetables or fruit you eat.
Right.
So that was one of the things that, they did in terms of nutrition.
Okay.
So it wasn't just one doctor. I had a whole group of doctors. And so right now I just saw my oncologist in August.
Okay.
I'll see him again, unless now I'm having a problem. I'll see him again in January. So I have 6 months. No, it's February because I have 6 months before I had to see him again. This is the first time it's been 6 months.
Okay.
So he brings me in and checks my breast. I'll see the radiation doctor in January and him in February because she comes in and she checks all around here too. So
Okay.
everybody else checks, along with me. I check myself constantly to see if I feel any new thing. I feel some pain over here. They said it was because where you have when you're growing back up, you have what's it called? When your skin is lapping up.
Okay.
Right.
Mm-hmm.
So basically, you're just watching yourself very clearly. The doctors are watching what you have. In the meantime, so this was in 2013, right? So
Okay.
I was doing pretty good in 2013. I went down to my home, coming to Tennessee State University. It was our 50th year. Went to a 50-year anniversary. We had a great time. Came back and was going. So it's time for me to go back for my, and in December, it was time for me to go back for my checkup for the bladder.
Okay.
Had it for a year. Went back for the bladder checkup. The bladder cancer was back.
Wow.
Oh my goodness. I said, what? She said, yes, back. So she operated on. She said, well, she gave me the date for operation. The date operation was in January again. So we get operated at 2/14. Sent it to the lab. They lab said it wasn't cancer. She said, I was sure it was cancer. It looked just like what I know what cancer is supposed to look like. So then I started having a lot of problems with urination.
Okay.
Couldn't urinate good. Having to run to the emergency room. Because one night I couldn't even urinate anything, and I was just in horrible pain. So I went on to in Chicago, because she was not in Chicago. She had moved from Mercy to a hospital way up north on Halstead.
Okay.
So I went to Chicago, and they had to put a tube in to get all of the urine out of my bladder. So I called her back, and I went back. I was in pain. They left the tube in, so I went back over there, and they took the tube out at that hospital. So Illinois Masonic, that's where she is now.
Okay.
So went back there. So she had her nurses take it out, and she looked up there. She said, "I want to look up it again," and she said back. And I looked. I could see, because you can see when they do in the bladder, they have this thing they put inside you.
Yes.
That's with a camera, and you can see it inside of you.
Right.
And they can too. So I said, "What is that?" Like cauliflower had exploded inside of it.
Okay.
And she says, "It's not as bad as you think it is." She said, "Put it back." She said, "We got to do the surgery again." So this is the second surgery.
Now let me stop you right there, Dr. Townsend, because that's a lot going on in a very short period of time.
I know.
How are you psychologically?
So I was kind of like, I was really in pain, because I was getting angry with the doctor, with the lab, I think, because he's saying one thing, and I'm feeling something else, and I know this is not how it went the first time I had the cancer, so I'm saying this is most serious. And my major thing was, I want us to get through with the surgery and start a treatment, because I don't want to lose my bladder.
Right.
But see, at the same time, there he goes, okay, I'll get it later on. At the same time, that when I had my first cancer, bladder cancer, the coroner of Chicago, we had it at the same time. People mistake the time that he had it, but he had it the first time the same time I had it.
Okay.
But his was so bad the first time they took his bladder the first time. So when it came back the second time, it wasn't just in his bladder, it had spread it somewhere else. So now I'm back with the cancer, You know, because when he first got it the second time, it was before I got mine the second time. My daughter called me. She was real upset. You know, the coroner's is back, and you all had it at the same time. I said, Doc, stop worrying about it. You know, I said, you know, whatever happens, it's going to happen. But I kept saying to her, I don't want to lose my bladder. So if we can do anything, can we start the treatments so we can kill off the cancer cells? You know, 'cause my thing was, you know, if we do the cancer, get rid of the cancer cells, I'll be okay.
Okay.
And for some reason or other, she didn't want to start the treatment. And so here it is the second time. So finally, I've had 2 surgeries now with her. And she's sitting back home. A week or so later, the bleeding started again. I had to go back to Chicago again and get a tube put in.
Okay.
So this is now 2 tubes that they had put in for me to Chicago. I had to go back over there for her to take it out. And then she does a 3rd surgery. So, did third surgery. I'm going like, this is 3rd surgery. I need to find another doctor. But I'm still hanging with her because at this time.
Well, stop right there because that's very interesting because I think a lot of people, between misdiagnosis and not really understanding or comprehending, if you will, what type of treatment they're having, what they need to have and when, how relevant is it to really, Dr. Townsend, how relevant is it to really understand what you've been diagnosed with and researching it for yourself?
Very important. It's very important. You need to go online and look up and read all you can read about these things. And at this particular point, I was still somewhat trusting her because she said it was cancer, but their lab up there said it wasn't cancer. So only when she sent it to the University of Chicago and to the lab up north, what was that lab? John Hopkins. She sent it to John Hopkins. And John Hopkins and the University of Chicago said it was cancer.
Okay.
So, you know, now she's back trying to get it back out, take some tissue out, and go wait for a little while before we can try to do it again, before we can start doing some things.
So that second opinion then is very important.
Yes, very
Okay.
important. So, so I came home, and so she said, I'm going to give you a month. I want you to go down and ask, I don't want to put his name in, your primary care doctor, can he draw some urine for me and send it to the lab and see what's in there. So he had me draw the urine, and when he drew the urine, he could see the blood. And I think for the first time, he really took me serious, you know, because he was not, you know, he was a primary care doctor, but he wasn't doing the surgery and stuff.
Okay.
And I think he thought I was just being a little bit hyper, you know, over when I was fussing about stuff. So he said, you've got to do something about this. I said, I've been doing something. He said, go here to Chicago, get another doctor. I said, I'm going to do that.
Okay.
You know, because I was going to do it before, and the reason why she kept telling me not to. And the reason why I felt that she was missing the point this time, not the point, but she had left Mercy and gone to Illinois on Sunday, but she was only there like 2 days a week.
Okay.
Because she had a contract with Cook County Hospital for certain nurses. I mean, not nurses, certain of the employees over there. And she could only see them. So I only had a chance to see her like 2 days a week. One day, because she would do surgery on one day. One day was for surgery. And the other day was just to see the patient.
Okay.
So, you know, she's way up here, still on Sonic 2900 North and West on Halstead. And so here she asked me to have the doctor down here to draw the urine, which was okay, and, you know, to do something. So, you know, by this time, my primary care doctor is looking at all the blood that was in, when I urinated, all the blood that was in the urine.
Okay.
So, I said, yes. So I called my doctor, oncologist, who he was taking care of the breast, but I called him anyway. And I said, I need to have a doctor, a bladder cancer doctor. I said, you recommend someone. So he recommended someone. And what in essence he has become, even though he's an oncologist, he's become the person that looks at everybody else's stuff, who does stuff here in Chicago. The only person I still have outside of Chicago is my primary care doctor.
Okay.
because all my other doctors related to the cancer, all the cancer is there.
Okay.
So, so I called him, so he found somebody. So I called this person, he said, I sent him the lab stuff from the doctor. And he said, I want to do my own examination. So he did his own examination. And then he set a date for surgery. Here is the 4th surgery. So I had 4 surgeries last year.
Okay.
Because I had 3 with her and 1 with him. And so, I was getting tired of the surgeries. It kind of messed with my life a little bit because usually I would go down to Tennessee State every year for homecoming. And I used to go for homecoming because, I knew I had to be here for when I was going to have surgeries. And you can't. When you have bladder problems, it's a little different than having breast cancer.
Okay.
Because I still got my bladder. And I was going to the bathroom. Sometimes I would go in every 5 minutes.
Okay.
Sometimes I go every 30 minutes. You never know. And you got to be somewhere where you can
Go to the
go
bathroom.
to the bathroom.
Yes.
You don't want to be embarrassing yourself or somebody else. My girlfriend always said, "Oh, Pete, just put on the pad." I said, "Yeah, but even with a pad, that thing stinks."
That's true.
You can smell the urine. Because I ran a senior program for years after I retired from the city colleges. I ran a senior program.
Okay.
And I used to have the seniors, and I'm going like, okay. I'll be walking around giving them stuff and talking to them. And I can smell it, I can smell the urine. But I never try to make a, negative view because I know if they could take care of themselves, they would take care of themselves.
Absolutely.
Right.
Absolutely.
So that's what I try to make sure I do for myself now. So we've had surgeries. The last time that I saw Dr. Smith was in May. I'll see Dr. Smith on the 30th of this month
Okay.
for the bladder cancer again. So right now I seem to be doing okay with the breast cancer. But in terms of the bladder cancer, it's still out there. I still got my bladder.
Praise God.
But I just kind of like trust God, but I also make sure that I go try to find me the doctors, and I read. I can't just take the doctor's word, Like I fight with the doctor, my primary care doctor all the time. He said, in fact, the breast cancer doctor said, "I don't think she likes me." Not Dr. Smith, but the other lady. Well, if I didn't like her, I wouldn't have gone back to her the first time. So he said, "Well, honey, she gives me hell all the time, but she's still here."
Because in fact,
right.
it is unnerving. Yeah,
Right.
it's a lot of things going on.
Sometimes you give me some mess. I said, "Did you read this stuff?" I said, the biggest fight I've had is with the drug companies.
Okay.
The drug company, the insurance company want to send you whatever they want to send you. Like my doctor, I was from high blood pressure. I was taking Atacant.
Okay.
And so all of a sudden they decided they didn't want to pay for Atacant. They wanted me to take the little mess they sent. They sent me 3 months supply. Now they've moved to this thing where you got to buy a 3 month supply of medicine. That's a continuation of medicine. They want you to buy a 3 month supply of medicine. So they sent me, instead of sending me the Atacant, they sent me some Candesar.
Okay. Which is a generic form.
Which is generic form, but it's not exactly the same thing. It's got something in it different. It has to.
Okay.
Anyway, they sent the little piece of paper with it about what to look for and who should use it. And on that clearly was, if you have a kidney problem, I have a kidney problem.
Okay.
If you have a kidney problem, if you have had cancer, you shouldn't use this stuff. So I called the people. I said, "Why are you all sending me this?" I said, "First of all, I have cancer. I have serious kidney problem." I said, "Are you all trying to make me die faster?" "Now, it's just like the Atacant." I said, "No, Atacant never had that on that."
Right.
I said, "The thing Atacant puts on stuff to try to protect your kidneys."
Right.
Every one of those diuretics don't always have something to try to protect your kidneys, because if you have a strong diuretic, it can tap your kidneys from having put out fluid too often. So I said, I need to send this medicine back. We don't take medicine back. So here I'm stuck on a 3 month supply of medication
That you can't use.
that I can't use.
Now stop right there, Dr. Townsend, because I think that's a very important place to talk to people who are going through it, and they're very upset, some even traumatized and thinking they're about to die. Because when you hear the cancer word, the first thing you think is, I'm getting ready to die.
Right.
But in fact, it's important to, one, we've established, and you told us that it's very important to get that second opinion.
Right.
It's very important to do your research, know what you've been diagnosed with, know what's going to happen to your body as a result of you having what you have, but most importantly, the medication that you're taking. Understand those side effects. And so for you, you actually found that they made a mistake with your medication. And they need to take that back. So what was that process like for you?
Insurance company don't care. They don't take it back. And so then I had to work with my doctor. And I probably shouldn't say this too much because he started giving me a different medicine he had in his office rather than he had to try to take that medicine. So I went the other day to get a medication he had prescribed. And even though they had prescribed, they had Phyllis said, we got another prescription here for you. I said, what is it? It's Candesol. I said, I haven't taken Candesol in 6 months or more. I said, well, who told you how to do that? Well, I said, I'm not using Candesol, so you can just keep it. I'm not taking. That's when I start having medication sent to me through the mail. I just go to the drugstore and get it. You know, the insurance companies they have really gotten tough on out here. They just into making money. They don't care about how well you are off. The other thing I like to tell people, you got to make sure that you talk to your doctor. You know, a lot of people go to the doctor and doctors prescribe a medication, and they don't say, what is this for?
Okay.
They don't see what are the side effects of this. You know, I come home and get on my computer, but a lot of people, a lot of African Americans still are not on computers.
That's right.
You know, especially older people. My girlfriend somebody brought her one. I just hate it. I said, how do you hate the computer? You know, I love it because I don't have to always go around and try to find it in a telephone book or somewhere. I can get on the line and pop the word in.
That's right. Absolutely.
Right. And so one of the things I like to say to people is that you need to make sure that you start to take stuff the doctors give you. You ask.
Don't take their word for it. In other words, know what you're getting.
You got to ask. And so most of the time, these insurance companies now say to the doctor, you have 15 minutes to see a patient. 15 minutes.
Wow. And that's when you have Medicare, Medicaid.
Right.
When you don't have like a Blue Cross.
I got Blue Cross this year.
And you're still having problems with getting good medication, good doctors.
Yeah, because see, and so when I asked the Medicare, the Blue Cross Blue Shield about, because that's what my insurance take care. That's why my drugs are taken care of through Blue Cross Blue Shield, not through Medicare.
Okay.
I mean, I had two Medicares, A and B, but I had because I had Blue Cross Blue Shield long before I got to be old enough to be in Medicare.
Okay.
And once you get to be in Medicare, some people drop the Blue Cross Blue Shield, but I didn't drop it. I kept it. I was too afraid to drop it.
Okay.
The reason being, you know, you drop it and you find before the last bill came out, the other insurance company could drop you or they wouldn't take you in. Especially with me, with all these things that have happened to me, they wouldn't want to give me any insurance because, you know, insurance companies shied away from anybody who had been sick, who had cancer or whatever. Just like this one man, I remember he came out and he was talking to me about investment. And so, I'm going to get you this, he said, what was it, long-term care policy. I said, I'm not going to be able to get one. Oh yes. I said, I've had cancer. I said, I've had more than one cancer. I'm not going to be able to get it. Oh yes, I mean, it'll work. I talked to the company. He came back and he tried to sneak in something else because the people turned it down. So he was trying to sell me something different. And I said, what are you talking about? We forgot to sign this paper here. I looked at it, I said, look, this is not what we were talking about before. We were talking about long-term care. Well, they said they couldn't take you in. So I told you that in the first place.
Right, absolutely.
I know that nobody's going to take me into long-term care. And I've had 3 cancers.
Right.
You know, they're into making money. And I'm not angry about that. But, you know, if you say up front that we're not going to take you in because of this, I know that. So don't waste my time and my money with me trying to do stuff like that. But the biggest problem I found with a whole lot of our people, when I say our people, I'm talking about our African American people.
Okay.
They don't ask any questions to the doctor. What does the doctor say? You know, they don't fuss. They don't ask. You don't have to fuss. You can just say, I agree, I don't agree.
Right.
This is not something that, you know, that works for me.
Right.
You know, because I remember I was talking to a doctor the other day, and my primary care doctor was gone, so he gonna tell me what I can take. I said, no, I can't take that. So I was calling to see was he in. I said, because the medication he gave me out of his office is out, and so has he figured out what he's going to do now in terms of medication he's going to prescribe to me? I said, because he has a hard time trying to figure out what I can take. But the first time he gave me any medication for high blood pressure, because I was up in my 50s, way up in my 50s,
Okay.
before I started taking the blood pressure medicine. It was just before I retired. And so he had given me a pill, and it dropped. I was in my office working on things, started getting black. I'm going like, what's going on? So I said, better get out of here. I'm going down to the main office.
Okay.
So somebody else could see me. So I got to the main office, and the young lady, the secretary, said, what's wrong, Dr. Townsend? I said, I'm not feeling too good. So she called the nurses. By this time, my blood pressure had dropped so low they couldn't even get it. So the little paramedics came. They were trying to put a needle in me. They couldn't get it in. So they just took me on over to Press St. Luke, because I was working right across the street from Press St. Luke. And Press St. Luke couldn't get the needle in either. So they had me drinking fluid.
Okay.
And what happened was the medicine he had given me had dropped my blood pressure so low until my veins were collapsing.
My God.
And so he had me drinking big jugs of fluid. About 4 hours I sit up there drinking big jugs of fluid to get it back up. So they called him, and he told them what it was. And so he realized then that he couldn't give me any of the strong medication, you know, for blood pressure. And so I figured out, if I don't eat outside, I'm doing pretty good.
Okay.
You know.
And when you say outside, you mean restaurant food?
Restaurants and stuff.
Okay.
You know, 'cause
Okay.
I cook it myself. I don't put salt and stuff in. I use half potassium, half salt
Okay.
mixture. And I've been doing that since around 20, because first my husband had high blood pressure. So I've been, you know, trying to take care of that, because he lost his kidneys and stuff, and then he died.
Okay.
So I'm trying to make sure I didn't lose my kidneys and thing, you know. But that's one of the things that I say to people all the time. You got to be sure. You got to follow what's happening with you.
Right.
You
know
got-
your body.
That's right. Know your body. Know it more than the doctor does, because it's your body.
Absolutely.
You know, I've said that. I remember some nurse said, well, you know, you don't. I said, look, I've been living with this body way longer than you've seen it.
Absolutely.
And so, you know, I'm not trying to make you feel bad about it, but it's my body. I have to be concerned with it. I have to tell you what has happened so that so you can understand what's going on. Because you don't go in and tell the doctor how you feel, what's happening here. You just get a general description of something, and he just pass you off with some medicine, and you go home.
Right.
You know, so, you know, one of the biggest thing, I mean, I'm sad about having cancer. I think the one thing that worried me most was not the cancer, it was the fact that when I finally got diagnosed with diabetes, that was the big thing. But then I learned how to control that. You know, I've really learned how to control that. I found my little...
Dr. Townsend, you're a walking miracle. You're just a walking, and I think for people who will ultimately look at your story and just really listen to all of the things, because you went from bladder to breast cancer,
Right.
from breast cancer, then you found out you had sinus cancer, which
Right.
we didn't really talk a great deal about that.
Right.
But then to go back and really have to deal with the bladder cancer again.
Right, right.
And then you know, fast forwarding, here comes some other things going
Right,
on
right.
with the body. And I know hearing diabetes
Right.
is certainly
Right.
very traumatizing and
Right.
very scary for
For a lot of people, right.
Yeah.
Right. Well, you know, because I know you have to change how you eat, and you have to change whether you worry about stuff. I think that's one of the things that I recognize, that I have to stay out of worry. Because if you worry about something, it has a tendency to change the hormone balance in your body, which also, you know, can change how your body utilizes sugar. Utilize carbohydrates. So people get hung up into saying, oh, it's sugar diabetes. No, it's diabetic. You're diabetic. And a lot of our people are like, I'm pre-diabetic. There's no such thing as pre-diabetic. You're either diabetic or you're not.
Okay.
You know, when you started seeing your sugar level running over 140, you are diabetic. You can stop it at that point if you lose the weight and if you get on a good diet. Now that's for people with type 2.
Okay.
Type 1 usually show up when you're a child.
Okay.
And it's a total different thing.
Okay.
You know, you have a harder time with type 1 diabetes. But with type 2, mine didn't show up until I was in my 50s, almost 60.
Okay.
Before it showed up, right? And I can control it pretty good because, you know, I take my medicine. In fact, I asked the doctor one day, I said, can I have the shot? So he said, you want the shot? I said, yeah, because they got the little pens now.
Okay.
They got a pen that's already in there. All you do is dial it down to the amount you need. And I just pop it in my stomach. And then I found this little machine that I put in how much, what my sugar level was. It was like 81. That's good.
Okay.
Anytime they don't really worry you too much about being diabetic if you're over 110. But I'm staying under 100.
Okay.
I'm trying to make sure I stay under 100.
And how do you do that? How do you?
I stay under 100.
Yes.
I have a little machine. I put in everything I eat. You know, I put it in the machine. You set it up to what the food is.
Okay.
And you put it in there, and it help you show you how much carbohydrates. I shouldn't have over 160 carbohydrates a day.
Okay.
And with 160 carbohydrates a day, I can stay under 100 sugar level, carbohydrate level.
Okay.
So, which makes me keep my sugar level in the normal range. Normal range is from 60 to 100.
Okay, and let's talk about your diet a little bit, because you look great. Praise God. So now, what are you eating? What's a regular 3-course meal like for you in a day?
Unfortunately, I don't always do a 3-course, but I should be doing a 3-course all the time. But I make sure I get my vegetables in. Don't eat a lot of it, but I eat vegetables. One of the things I discovered was that certain vegetables is high, will give you gout.
Oh, okay.
You know, we
wow,
think,
yeah, that's another issue.
You know, if you think you got to eat greens every day, it's not a good idea.
Okay.
Because it's got a lot of uric acid in it.
Okay.
Anything that's got a lot of uric acid in it, you need to stay away from it. You eat a little bit of it. So I'll eat green beans, broccoli. That's not broccoli that usually have uric acid in it. But they discovered cauliflower, which is not a green vegetable. Cauliflower's on the list. I stay away from it usually. Okay. But I'll eat broccoli, I'll eat green beans, and I'll eat some greens sometimes. I'll eat kale, but I don't eat it frequently. I used to eat that stuff frequently.
Okay.
I had a habit of snacking on nuts,
Okay.
which is supposed to be healthy for you, right?
Okay.
Almond nuts and peanuts was my favorite thing. And once I discovered that wasn't a good thing for me.
Okay.
Because I would get blocked up. And I wound up in the hospital twice with blockage.
Okay, from peanuts.
From
what about
peanuts.
popcorn?
Popcorn, no, all 3 of those
Are bad for you.
Yeah, bad for
Okay.
me. They're not bad for everybody else, but for me it is.
Okay.
Because I had surgery back in '72, and behind that surgery, I've now got scar tissue.
Okay.
And scar tissue is narrowing up my colon. It's not inside the colon, it's outside.
Right.
Scar tissue is outside. So it narrows it up. So those foods are usually high fiber foods, which is supposed to be good for you, high fiber.
Right.
But the problem with high fiber for me is that the fecal matter will go down too fast sometimes and get stuck in that little narrow spot.
Right.
So then you have to wait till they get it out of you. You can't eat no food, you can't do nothing. My last bout was in this last year in June.
Okay.
Well, on June 21st, when I was in the hospital, stayed the whole week before I get out. So, you know, so I convinced myself, well, you cannot have the almonds, forget it. Because I would have almonds, I'd go buy bags of almonds.
Almonds.
Yeah, because rather than eating candy and cookies and stuff,
Right.
if you ask me in my house, I have no cookies in this house.
Okay.
I don't have it, and I eat very little bread.
Okay.
White bread, I don't eat white bread at all. I eat wheat bread, but I eat very little of that too. So what I was doing, I was trying to stay in the carbs a lot, but there are certain healthy carbs. So instead of walking by and getting some cookies and stuff, I would walk by and pick up me some almonds. The lady who comes and help me clean, she hadn't been here for a while, but the lady who comes and help me clean, she was the same way. She passed by the almonds and she said the other day, "What happened to it?" I said, "I came back." She said, "Well, we can't eat almonds." Well, I said, "Well, you can eat almonds, but I can't."
Okay.
Okay. I pass by, get 3 or 4 almonds and eat them, and that was satisfy my chewing thing.
Okay.
I definitely have stayed away from the popcorn. Loved the popcorn. That was my diet at night.
Okay.
Before I would go to bed,
Right.
I just sit down and have my popcorn.
Absolutely. Absolutely.
So I've had to let that go.
Okay.
I had to do popcorn, can't do peanuts, can't do the nuts.
Okay.
But
What
those are
about
healthy.
something simple like coffee? Do you still drink your coffee?
I drank 1 cup of coffee a day. They told me to stop drinking coffee. I stopped for a while, but I probably need to. But I only drank 1 small cup a day, and I basically do that because it helps me go to the bathroom better.
Okay.
I mean, in terms of habit
Absolutely.
elimination, right?
Right. And then what about tea and?
Yeah, I can have a lot of tea. I can have tea that doesn't have caffeine in it.
Okay. And do
Right.
you juice at all? Because you know a lot of
Yeah, I have
people
fruit
say juicing
juices.
is really
Right.
good for you.
It's good for you, except people forget. If you're trying to lose weight, if you're trying to lose weight, or if you're trying to control your carbohydrate level, because sugar is a carbohydrate,
Yes.
then when you juice, you better juice with green stuff. You know, lettuce, not lettuce, lettuce don't give you nothing in it really. There's no benefit to the body. People don't understand that. But if you want to juice up, well, certain kind of lettuce you can juice up. But like green things like kale, you can juice up kale, put it in a machine, the Montel wheat machine, juice it up with, maybe a piece of tomato. Even when you're juicing, you should count that stuff. People don't. My girlfriend who's been trying to lose weight for I don't know how long, and she would tell me about, what she juiced. She juiced this morning. I had all my juice. I did my juicing thing. She added the banana. So I said, you had 100 calories before you add the banana.
Wow, and you really don't. You're thinking that you're helping yourself, and you're really hurting yourself.
Right. I said, you put that in. You put the banana in there. It's 100 calories. She said, well, they gave us some apples the other day from the church because somebody in the church had a lot of apples. So I said, so okay, you put the apple in, and you put a banana in there, and then you may put a small amount of some kind of green vegetable in there. But the biggest thing you got to hurt yourself is with those bananas and the apples both.
Right.
Because 1 apple is not enough, because you can't get very much juice out of 1 apple.
That's right.
So they most likely going to put 2 or 3 little apples off in there.
Right.
And each one of those apples got 75 calories in them. And
Right.
so people don't think they don't think about what up going. Your body's you got to look at the calorie count. So yeah, I do juicing. I've done juicing sometime, and I'm not doing as much as I used to do.
Okay.
But I had the Montel wheat. I had to stop doing the Montel wheats because it had the fiber in it.
Okay.
And I had to get away from the fiber for a while.
Okay.
So I started just doing the juice period where you take all the other stuff away. Now the best one is actually like the Montel wheat when you still got everything but just grind up real small.
Okay.
Are you familiar with the Montel wheat machine?
Yes, I am.
Yeah, right. So, because you can even make soup with the Montel wheat.
Right, that's right.
Right.
Uh-huh.
So that one, so it's fine. When I was doing juicing a lot, when I do juicing lots, I'll find beets. I'll put a piece of beet
That's
in.
good.
Go to the store and get some beets. And cut a piece of the beet. Put it in
Okay.
there. Use cucumbers, because that can give you
Yes.
fluid.
Mm-hmm.
Basic cucumber has no other food value except to give you food.
Okay.
Food. I see people claiming it does, but
Okay.
it really doesn't do that much. I grew up eating cucumbers every day,
Okay.
and I never lost a pound. But because we grew cucumbers,
Right.
and so you could go out there and get them.
Right.
And of course, I had to stop eating tomatoes one time because my mother grew tomatoes all the time, and I ate so many tomatoes until those things created acid in me,
Right.
and I ran up with the acid thing. So I had to stop that. But I eat tomatoes every now and then. I eat small amounts of tomatoes
Okay.
because I need that.
Okay. So now, Dr. Townsend, as we begin to wrap up your interview, and I certainly appreciate all of the time that you've given me, let's go back and recap some things, and I just want you to just kind of really talk to people they just got their diagnosis, and we go through this, oh God, I don't know what I'm going to do. Let's go step by step in your own words. Just tell us from the moment that you get the diagnosis for whatever form of cancer that you have. For you, let's talk about the first 5. Is that okay?
Okay.
Maybe the first 5 things that you should do immediately after you're diagnosed.
Okay, the first thing I would think is you got to make sure you have friends. You tell your friends about it. You talk to your friends about it. That's the first thing, because you got to get a cadre of friends that can work with you. Tell your family about it. Your family got to be there too. But also make sure that you check for a second opinion before you do anything else. Before you do any surgery or anything, get a second opinion of what you have going on with you, because that's very important. Read up. Don't panic.
Oh,
the first thing is don't panic, because if you panic, then you can't think about doing the other 4 things you need to do. The first thing is don't panic. Well, how do you not panic? Pray over it.
Wow.
Ask God to help you through this, guide you through this, and take the position that, I take the position that we can come here to stay. That's the position I take. And that each day that God gives me is a blessing.
Amen.
And so don't panic. Pray over it. That's the first thing in my mind. Next, you got to talk to your family. Get your cadre of friends, because you need to have friends to be with you through this. They can help you. And do not sit home worrying about it. Get up and get out.
Good.
Don't stop doing stuff that you can do. If you've been going to exercise, continue to do.
Keep your routine.
Keep your routine.
Your routine's
right,
important.
Right. Keep your routine. Find fun things to do. To keep your mind off worrying about it. On Thursday, this past Thursday, a girlfriend of mine, daughter, had a birthday, and decided that she was going to have a regular birthday party. She had a paint party.
Wow.
You go, you know what I'm talking about?
Yes, absolutely.
And so we all,
wow.
Somebody said, Dr. Townsend, the girl who comes to carry me to the airport sometimes, said, Dr. Townsend, you with that too? You paid it too? I said, yeah. And she had an aunt that was 80. They said, Aunt, did you pay? Yes. Yeah. And so it was pretty funny, because the aunt said, he don't have any clothes on. I said, I thought you knew that before you came. So,
that's beautiful.
You have
that's
to get
wonderful.
Off. Find things that give you some little fun every now and then.
That's wonderful.
Don't sit and I have too many friends who have become alcoholic as they got old.
Yeah.
I mean, that's one of the worst things that I can see happening. Friend alcoholic, driving a car, tearing a car and then lying about somebody else hitting the car.
Right.
So because when she retired, she didn't find anything else to do.
Right.
You've got to do something outside of yourself. If you worry about yourself all the time, if you just stop and don't think about somebody else, then you don't worry about yourself. Right. You got to look out, put your focus on something else. Right. Get involved in other things.
Because it really does help you.
It helps.
And depression, I know you talked about that earlier. You talked about the depression and how it'll start certain things taking place in your, you have those chemical reactions in your body and different things are taking place. Right. And all of that can really be avoided if you understand your diagnosis. And I'm just recapping for those people who are like, what did she just say? So you want to have you want to have your cheerleaders. You want to have people around you that are encouraging you, that are there if you need to talk about anything. Sometimes it's not necessarily just talking about the cancer, but
you talk about something else. Don't just always talk about the cancer. Right. And you get away from negative people.
That's good.
Negative people will not help you. You have to have somebody positive, somebody who understands. Even if you got a group who's been through cancer before, talk to them.
Right.
Who's got through the cancer, who now, because I've had some friends who had to have chemotherapy, not chemo, the chemo, and it really wears you out.
Yes.
Luckily for me, I've not had to have chemotherapy yet.
Praise God.
But it wears you out. I've seen people follow in church because that was how sick they were. chemo, but they got through that. They kept going,
Praise God.
and they still walking around. And you know, for every time you have passed by a step, you need to be thankful for that. If you've gotten over something that's really bad, be thankful, you know, and let your friends know that you've gotten through this.
This is a milestone.
Yeah, let them know
Yeah.
you've gotten through this, you know. And they always stay. I mean, a friend of mine had a party yesterday. I was right there.
Wow, wonderful.
It wasn't a paid party this time, though. But, you know, it was there. And so I go to parties, I learned how not to eat certain things. I find out what I could eat. I asked outside. In fact, my friends know now that they would have fixed some chicken sometime.
Okay.
You know, like she baked the chicken because, you know, I'm not going to eat any pork.
Right.
And I'm not going to eat any beef. I don't eat any of those. I eat fish and chicken and turkey. That's what I eat.
Mm-hmm.
And I kind of, you know how to fix it. Get away from fried food, because it's not really good for you. There's a way you can fix food. You can bake it up really good. You can even dress chicken up in a way to change the diet.
That's right.
Right.
Absolutely.
So, you know, and don't forget the vegetables. Eat plenty of vegetables and eat fruit.
So what do you do outside of your diet? How do you stay so positive outside of your friends and just like when you're home alone, you know, and I think for a lot of people that's the time when the depression sort of kind of creeps in on you and your mind starts to wandering. For people who spend a lot of time at home and don't have the array of friends like yourself and all of the activities, what can they do at home, in your opinion, to just kind of really keep themselves busy, really focus on not, thinking about cancer and getting depressed? Well, so what can I do if I'm homebound?
Yeah, homebound is a little different. It's definitely different. You know, there are people who you can talk to, you know, who can call you if you can't get out the house, you know. But every person who thinks they're homebound don't need to be homebound.
Right.
You know, they can go, first of all, if you can't drive anymore and take yourself places anymore, there's PACE. You know, you familiar with PACE?
Yes, absolutely.
You know, get in touch with PACE. PACE will send you stuff. They'll sign you up. They'll take you out. They'll take you get your groceries and stuff if you can manage that. If not, you get a wheelchair if you can. You know, get out.
But the key is to keep moving.
The key is to keep moving.
Right.
And if you're home, also, find movies that's funny.
That's wonderful.
You know, I always,
that's very good advice.
My girlfriend said, "Who are you talking to?" She called me. She heard me as I was listening to the phone, was falling out laughing. I said, "I wasn't talking to nobody. I was watching the movie on TV. That was really funny." You know, try not to find a movie that's really depressing, but get funny movies. You know, that you can laugh. Laughter is really important, and often people don't understand that when you laugh, you release something.
Yes.
That you don't release when you are sitting up crying. When you're crying about stuff,
it's inward. It's affecting the body.
Right.
Yeah.
So basically, that's what. Did I give you the 5 things? I think I did. The first one, I said, don't panic. That's the first thing. Don't panic. Get your family. Get your friends. And I left the 5th one off, didn't I? Oh, and pray.
Prayer.
I said prayer.
Yes.
You gotta pray.
Absolutely.
Right.
Dr. Townsend, thank you so much for sharing your story with us. And I know that it's going to be very, very encouraging for people who are, just going through it, or may even have a relative. And I know we didn't really touch on that, but just being the supportive person for a relative, a mom or a dad, or even a sister or someone that has been diagnosed with cancer. And before we conclude, I think that maybe we should just touch it a little bit. How do you what do you recommend for somebody who's supporting someone who has cancer? What don't you say?
for people who are supporting someone, which is really important too, because too many people wind up taking care of the sick and they die before the sick people.
Wow. That's
Because
a good point.
they have to figure out a way to release that, to get out some time for themselves. And then oftentimes they fail to do that. They fail to be able to focus on themselves too. They think, oh, my whole focus got to be on my family, and I don't have time for myself. But if you don't take time for yourself, then you are actually going to wind up sicker and pass away with you before your family member will. That oftentimes happens. I mean, I've known people taking care of their wife. Man was making his wife. She was still here and he was gone.
Wow.
You know, so the thing is, you got to find the same things for yourself when you don't have cancer. When you don't have cancer, you got a family member who have cancer. You got to figure out a way. You get to pray and ask the Creator to show you a way that you can still take care of this person, but you can also control and manage your life in a healthy way. You got to eat right. You got to find a time to be out. I discovered there's this thing, my girlfriend told me about, Wilma told me about it. Her husband has Alzheimer's.
Okay.
And I knew this other man whose wife had Alzheimer's. And there's a place where you can go, what is it? I forgot what it's called, where you can take that member and they'll keep them for a week.
Wow.
So you can get out and enjoy yourself for a week.
Wow.
Because you need that. You need to get away from the people. You know, even you need to find some friends who may come over. Because I used to go and sit with the man, wife for a while he would go to the bank.
Oh.
You know, because I was saying, you need to stop going to the bank. This way you need to have your money sent to the bank, you know, rather than you take it through the mail and have to take it out there. I said, but, you know, I can understand that was a way to get out of the house.
Right.
But, you know, but find other things to do to get out of there. You do need to ask some friends. If you got a good friend, can you sit for a little while I go to the drugstore or whatever?
Right.
Just to get away.
But you really do, because what I'm really hearing from you is that you really need a healthy routine.
Right.
And you need people around you that will support
Right.
you.
Mm-hmm.
Many supporters, in
Right.
fact.
Right.
You know, so that you're not inundated or overwhelmed
Mm-hmm.
with being the support system for the person that you love.
Right. That's right. Very true. You've got to be able to take care of yourself in order to take care of somebody else.
Absolutely.
You know, like I tell people oftentimes, you got to love yourself first. You can't love anybody else if you don't love yourself.
Absolutely.
You know, you've got to do those things. So basically, that's, you know, what
That's
I
wonderful.
advise.
Great advice.
Thank
And
you.
again, Dr. Townsend, thank you so
Okay.
much for allowing
All
me to
right.
come in your home
Okay.
and talk about your story.
Okay.
And again, like I said, I just know that it's going to be such a tremendous blessing to people who don't know.
Right.
And I think, you know, one of the things that we talked about, I think which was very vital for me, is to really know, understand the diagnosis,
Right.
research it,
Right. Right.
and get that second opinion.
Mm-hmm.
And in the process of researching it, when it's time for whatever medication, for whatever treatment,
Mm-hmm.
to research that treatment,
Right,
make sure
right.
that you're getting
Mm-hmm.
the right medications. And if you're not comfortable,
Right.
ask more questions,
Mhm.
refuse it
Right.
as you did. And I
Right.
think that was very touching for
Mhm.
me, that you said, wait a minute, no, I'm not going to take that.
Right.
That's not working for me.
Mm-hmm.
And then when you have the, when you're not, in fact, comfortable with the physician that you have,
Right. Find another.
be willing to change.
Right.
And I think that those were all
Mhm.
valuable,
Right.
valuable insights
Right,
and great
right,
wisdom.
right.
And again, thank you for it.
Thank you.
Amen.
Like I hope I was helpful to someone.
I know you were.
Okay.
I know you were. Excuse me one moment. Let me turn this on.